Okay. All right. So welcome everybody. So we wanted to bring you all together to discuss some new information regarding COVID-19, some new government guidance that we've received, and how that impacts the staff and the individuals that we support. Steve had sent out an email last week, and we just wanted to make sure to provide this forum so that if you have any questions, you have an opportunity to ask, and we can clarify some of the information that was provided. So we have today myself, I'm Linda Schellenberg, the Director of Community Services. We have Trinette Hyman, the Director of Residential Services, along with Joanne Cropper, the Director of QI and Training, and Radina Hernandez, the Quality Assurance Director. And Melanie, are you on, Mel? I believe Melanie. I didn't see her.
I am.
Oh, great.
I'm
okay.
Here.
and Melanie Singleton, our Assistant Director of HR. So we'll be, each of us will just share a part. And if it's okay with you, Radina, if you wanted, would you mind starting?
No problem. Hi, everyone. So as Linda mentioned, Steve sent out an email last week talking about designated cluster and mitigation and oversight. So basically the Department of Health on October 23rd put out some guidance that came down from the governor's office. Since the onset of COVID-19 as a public health emergency, the state has relied on data and metrics, science and public health for all decisions impacting public health. So Governor Cuomo has introduced a new data-based strategy to aggressively respond to the microclusters throughout the city, well, throughout the state, really. In particular, we're just going to focus on the 5 boroughs for us where the microclusters are popping up. So based on the initiative on October 23rd, it's really more to focus a response in define geographic areas and addressing transmission on a more focused basis. So related to, stemming off of the Department of Health guidance, OPWDD put out their own guidance that took effect on October 23rd, where they designated different clusters by, it's like a color system. So you have, let's see, red is called a microcluster zone, orange would be a warning zone, and yellow is a precautionary zone. So what we as an agency have to provide is information to our staff regarding these microclusters and what it means moving forward. So for example, the agency will be provided with an email if, for whatever reason, any of the areas where we provide services or have any of our residences are within any of those designated areas that fall under either red, orange, or yellow. As of the last notification that we received, which was around October 24th, 26th, we only had 3 residences at the time that fell within those clusters. And what the agency is mandated to do is ensure that staff are aware that they are working in one of those areas and that they are encouraged, the staff and the individuals, to get tested on a weekly basis. So what we did is, you all saw the email that Steve sent out. In the email, embedded in the email, is a link to the website, to the New York State website, where you can actually enter your address or your site where you work to see if you're in any of the designated clusters, red, orange, or yellow, as well as a separate link where you can put in the most convenient address. It could be your home address or close to where you live, and it'll give you the closest testing site if you choose to. We did put together we provided an email address. It's an HR email address. If you do fall within these clusters, or just want to proactively get tested, you can reach out to HR and let them know that you got tested. So the hope in this is, because there are asymptomatic people that sometimes obviously have the virus, they're not showing any symptoms, they could be spreading it. The hope is that we can catch those people in those areas and mitigate the spread of the virus. So it's just an enhanced testing criteria. What we're doing subsequent to that is, if we identify that there are services being provided within one of those clusters, we're sending a focused email or ESCOM to those staff that work in those areas, just letting them know, it's been identified that you've been working in an area that has been shown to be in one of these clusters. This is what we require. This is what we're encouraging to do, and this is where you can go if you want to get tested. Please let us know if you do and what the results are. Now, in addition to that, so yellow right now only stands for that if you're in a yellow zone, you're encouraged to get tested on a weekly basis. If you're in an orange zone, for example, if you're in residential services, we have to also modify services visitation, let's say, in the houses. So at orange zone, we would the visitation would be open, but it's dependent on if we have any cases in the house positive, any positive cases. If it's red, we have to suspend. If the residence is in a red zone, we have to suspend visitation until further notice, or until they move off of that red classification. For community, it doesn't really seem, aside from needing or recommending that staff get tested and individuals get tested on a weekly basis. And for all criteria, red, orange, and yellow, it's always recommended to get tested on a weekly basis. For community, like I said, it only applies mostly if we're providing services to more than one individual at a time, which is not really the case in community. That's where the services would be. So for orange, if there's 4 people being provided services at the same time, then there's some limitations to that. If it's red, if it's 2 or more, so it doesn't really fall for that, but it fall within that. But for red, orange, and yellow, the recommendation by the state and by OPWDD is that everybody get tested on a weekly basis. And again, we put the information out there so that you guys can look into, if you live in an area, or if you just want testing information, where you can go, where you can possibly get a rapid test, what's closest to you. The information's there for you. There is a new guidance that came out that was effective yesterday, that if you do get tested for a proactive reason, so proactive meaning it wasn't because you came into contact with someone that was positive. It's not because you already have symptoms. It's just because you're concerned, you just want to check to see if, for whatever reason, if you're positive or not. We do have to enter that into our incident reporting management system. The state does want to know, because if it comes back positive, then at that point it's considered a COVID-related incident, and they use that information to complete contact tracing, which contact tracing is very important, because that's how we try to mitigate as a whole the spread of the transmission. So if someone comes out positive for having COVID, they try to go back a certain amount of time with the help of the Department of Health to ensure that we get in touch with everybody that you might have come in contact with within a certain amount of time, and encourage them to get tested, and take precautions or quarantine for a certain amount of time, see if symptoms develop. So it is very important that if you choose to, or you end up getting tested or being given a quarantine or isolation order by a healthcare professional or your local health department, that you communicate back to HR and QA and let us know. There are several steps we have to take. With that, I'm not sure if are we taking questions now, Linda, or at the end?
I don't see any questions in the chat, but
Okay.
I did type that, feel free to use the chat for any questions you might have. But yeah, if you want to take questions, I think Radina has the most important information to share about this. So we want to make sure that you guys are following, that you understand. So if anybody does have a question for Radina.
Okay.
Okay, so Joanne was going to share a short video, but she was just texting me that the
I'm
videos.
sorry.
Oh, go ahead.
Somebody did put a
Okay.
question just
Okay.
now.
Good.
The question is there anything to do if you are not in any of the zones? Nothing mandated, but obviously we're going to stress that everybody, take the common precautions that are out there, wear face covering, especially, when you're in public places, when you're working with individuals, wash your hands, monitor for any signs and symptoms in yourself and those around you, family, staff, just, keep an eye out for what's going on. But right now, if you're not in one of the zones, there's nothing that's necessarily mandated. If for whatever reason it pops up that you're working in one of those zones, you will get a specific email. It's just alerting you, hey, by the way, it looks like you're working in one of the zones. So we'll keep track through HR and QA and your supervisors of the zones. And send out specific information for you so you are aware that you're in one of those zones and you can go and get tested.
I did notice, and again, as Radina said, the best thing is to check the website so that, use the address finder there. The map it will show you, but for those of you familiar with Brooklyn, your address is Brooklyn. So you have to really put in your address to make sure if you fall in that yellow zone. In Queens, you can see certain neighborhoods, Forest Hills, parts of Ozone Park, in Far Rockaway, some of the other neighborhoods in Rockaway. So you have to really drill down. In Nassau County, even, there was part of the 5 towns fall into the zones. So, just to let you know, I didn't see anything in Staten Island, Manhattan, or the Bronx. Is that right, Radina, as of today?
As of today, because it changes all the time, but as of today, and your best bet is to actually enter the address, because then it'll tell you, no, you're not in any of the zones, or it'll tell you you're in a yellow zone, red zone, orange zone. If that comes up, then feel free to reach out to us, especially HR or myself in QA, and then we'll tell you what the steps are. But like I mentioned, for any of the zones, the encouragement is that you do monitor yourself for signs and symptoms and get tested at least weekly.
Okay, great. And then, Joanne, did you want to talk a little bit about the video?
The video is just a very short video, but it kind of covers what Radina has just said. It's the importance of testing and why you should get tested to stop the spread. So, if you have come into contact with it, or if you've traveled, or you're living in the zones, it's just the importance of getting tested. I would also recommend that if you are, I'm not sure how many DSPs we have on the call, but if you are scheduled for training, please keep that in mind as well. We're running very small training classes, but if you are in the zones, please take that into account as well. If you're coming to trainings, if you're working in a house where there's positive cases, you shouldn't really be coming to the training classes. That's all I have for everyone.
Okay, great. And we will share that, the video, maybe we can get that up on the website. So I just wanted, go ahead.
Linda, I'm sorry. Someone's asking where to look up the zones. Can we drop that in the chat?
Yeah, I'll do that now. Yeah, and actually that is a great segue. So I wanted to just share, I'm going to just share my screen here for a minute. To just remind everybody, I know we've been in the thick of this for some time now, but just as a reminder, on our website, if you go to the news tab from the homepage, so it would be cfsny.org. If you go to news, there's a coronavirus alert. We do try to keep this page up to date. So, it says Yeah, so this is the letter that Steve sent out, and in here has the link, as Regina mentioned. This is the link, and I will drop this into the chat as well. But this is the link to take you to enter your address. This is the link that you can find your closest testing site. And here's the HR email address, a special email address that you're going to use to notify HR that you went to get tested, and if you have either tested positive or tested negative. So if you do get tested, you know, just let HR know either way. In addition, there's a good FAQ here, HR questions, and the protocol. So I wanted to just, I know Radina mentioned a little bit and Joanne did as well, but you know, we are still in the thick of this, and we are looking at, you know, an uptick. So in order to prevent, you know, higher numbers, we all have to do our part in staying safe. So we are still requiring the use of face coverings. We know people are getting fatigued, where they're just feeling like this is enough already, and I think everybody understands that. But we have to keep in mind that, you know, if we don't take these precautions, we really are running the risk of not only exposing ourselves but others. Washing hands, avoid touching your face, staying home if you are sick, and monitoring those symptoms, which include the fever, shortness of breath, sore throat, cough, headaches, etc. And you need to let your supervisor and your doctor know if you are displaying symptoms. And of course, maintaining appropriate social distance whenever possible. We understand for the services that we provide that oftentimes that's not possible to maintain social distance, which is why, you know, the use of the mask and washing hands is super important. So the oath of responsibility that everyone signed, I can't remember when that was sent out, maybe in the summer in July, that is here. There's the mask wearing 101. We have some screening forms, the travel restrictions. As they get updated, you can click on here to see. There's some mental and emotional health resources, the community safety guidelines. Again, you know, for me, for my team in the community services programs, you're working one-on-one with the person. Oftentimes you're out in the community, which is positive. We want people to get out and do things. We just want to make sure it's being done safely. We have that also in Spanish. So there's a lot of information that's here in resources. We try to put it up here so that you don't have to dig around. So most importantly, pay attention to this new information on the cluster, the hotspots, the clusters, and the microclusters. And I think, Radina, it's safe to say that we'll let people know when that information gets up to date. Like if the map gets changed. Okay, so we'll
Yes,
let.
we will. We'll be sending targeted emails if we identify that a staff are working in those areas.
Okay, great. Yeah, and so I just, you know, wanted to also once again just repeat that, you know, we have to do this all together, and the people that we support and their families and our own families are depending upon us. So, you know, people that are taking, you know, really consider if you're traveling. You know, is this the best time to do that? Are you around the holidays? Are you having big family gatherings? You know, is that the smartest thing to do? You know, these are all, you know, recommendations that as the weather is getting colder, people are more indoors. That's when you see these upticks of cases where these family gatherings are happening. So we have to be really careful and creative in how we're going to continue to keep people together and keep our spirits up as the winter is upon us. Okay, so I wanted to kick it over to Trinette. If you wanted to talk as well.
Hi, yes. I just wanted to, you know, for those houses in the yellow zone, we did have the individuals tested, and so we encourage the staff to get tested as well. I know it could be a bit much having to get tested every week, but, you know, maybe if we could at least do it every 2 weeks or once a month so that we can be insured, because it kind of defeats the purpose if we're having the individuals tested and then staff is not getting tested as well. Then, you know, they may be bringing it in because we don't know where they live. They might actually be living in a red zone and bringing it into the residence. And then we have to quarantine, you know, the entire residence. So this is why we want you guys, managers and supervisors, to really press those staff to strongly encourage them to get tested, because we can only, you know, try to.
It's a meeting.
We can only be preventive if we know.
I'm in a meeting to my job.
Sorry. We can only be preventive if we know, you know, beforehand. And of course, encourage all staff to, well, not encourage, they must be wearing masks while they're working in the residence. Sometimes we be on Zoom calls and we notice that not everybody's wearing masks. We must let them know that it's very important to wear the mask, sanitize their hands or wash them as often as possible. And when they're coming on shift, the managers, you guys have to make sure that you are taking the temperatures and going through that whole screenings with them and documenting it, because we could be asked for that down the line. We will be asked for it. So you want to make sure that you're documenting that and just letting them know that, you know, we want everybody to be healthy and, you know, trying to get through this as safely as possible. I don't think there's anything else.
Okay. We're going to round back to Radina as well, but Melanie was also going to talk about the flu vaccine. So this is something very important. And if you wanted to also touch on I know we said that they have to email you, Mel, about test results, but if you wanted to talk about any other protocols where HR needs to be notified, feel free.
Okay. Can you hear me?
Yes. Mm-hmm.
Okay. Hi, good afternoon, everyone. Hope everyone is being safe. I'm a couple of hours, I emailed out the flu shot flyer. So this year we are taking more of an initiative to promote the flu shot due to COVID still being present in our communities. And therefore, we're asking and we're encouraging everyone to get a flu shot this year. We're also upping the ante a little by offering you a gift card. And if you already took your flu shot, please send in a receipt just as a confirmation, and you could send it to the DL HR direct email. That's DL HR direct email, and I will definitely get your gift card out to you. But again, you know, the COVID is still around. It's still an uprise and uptick. So we're encouraging everyone. And if you don't have a PCP and you want to take it through CityMD, kindly email me directly to my email, and I'll email you back the medical processing form just for the flu shot, and you could go and have your flu shot taken at any CityMD location. To piggyback, I'm going to the cluster, the HR cluster testing. Well, just to let you know, we're piggybacking off Radina's information. If we get any of the COVID tests and it so happened to return positive, we're going to continue doing our due diligence. So what that means is that employee will notify us directly, and you can utilize the HR cluster testing email at cfsny.org, and myself or Maria will follow up, and you will need to send a receipt of your test indicating the positive results. We will then pay you out the 14 days of sick leave, and we have to do our contact tracing and exposure letter to the employees that possible could have, you know, you would have come in contact with. But pretty much we're still doing our due diligence, but we're also, again, encouraging everyone to take their flu shot. And again, if you have any questions, you're unsure, kindly feel free to email myself, Denise, or Maria, or if you just want to use that HR cluster testing email, you may do so also. Okay, thank you. Any questions?
Yeah, there was a question about the nasal test bit.
Mm-hmm.
So the type of test, I guess, that's administered. So if
I
a
think
person gets tested,
the nasal test gives you a more accurate result. I think someone asked me earlier about the antibody, and the antibody just pretty much, tells that the COVID is still present. But I think with the nasal, it really rules out whether or not you have the COVID. Well, can I say it this way? If you are positive, if you're between you're positive or negative. So I normally would recommend taking the nasal test because it gives more of a definite result.
I think the question is, if they test positive for antibodies, do they have to send that into HR? So if they test negative for COVID, if they do a nasal test, but if they test positive for antibodies, do HR need to have that result sent to them?
They should send, everyone has been sending all the results, so they could continue doing so. But if they did the antibody, I would recommend, and I believe I told this to someone earlier, I would recommend taking the nasal test just to get the proper outcome.
Okay.
And are you
I hope I
accepting the
answered
oral?
that properly.
So the antibody test is not definitive. So really, you want to see.
No, it's not. It's the nasal. Yes, the nasal show a better result because sometimes with the antibody, there's two sections. One may say negative, and the other says positive. So it's giving you like two return results. With the nasal, it gives you whether or not you have COVID or you don't have COVID. So that's why I'm recommending the nasal.
Are you accepting results from the oral test? That's another question.
Yes. I'll take the results from the oral test also.
Okay.
So long as it gives us that positive, it shows that there's something that we're looking for on the form, and which we've done, since back in April, May. But we need to get the positive results, and there's a language within that result that will tell us yes or no, the person is positive or negative.
Okay, so just to clarify, so you're talking about if a person is positive, for them to they'd quarantine for the 14 days, and for them to get paid out, you need to see that nasal or oral.
Right. We need to get the receipt, the results, and then we'll definitely pay them out the 14 days, which we've been doing for the employees in the past that has come up positive.
Okay, and then for this cluster, for the new cluster testing, if a person gets an antibody test, should they bother sending that to you, or is that, I don't know, Radina, is that something?
No, no, sorry.
I would recommend. Go ahead, Radina. Go ahead.
They can let us know, but in
Right.
reality, it's just an antibody test doesn't let us know if you're positive for COVID at this time. It just means that you were introduced to the virus at some point.
Right.
So it doesn't hurt to let us know or let your supervisor know, but it's not necessarily, something that we need to report or do contact tracing for. It's just pretty much says that you were introduced to the virus at some point.
Okay, Radina, did you want to add something?
Yes, I didn't know if there was any more questions because I signed off and signed back.
Okay.
All the questions were off off my screen.
Okay, yeah, I think they answered the questions. Yep.
Okay. The only thing I just wanted to piggyback off of what Melanie was, letting you guys know regarding the flu vaccine. The flu vaccine is at this point is the most effective strategy for preventing the influenza, the flu. There is some guidance that is coming out. We're trying to put together, OPWDD has put some guidance together called the flu/COVID management in anticipation to the flu season. So what they're asking is the symptoms are pretty similar for the flu and for COVID-19. It's fevers. For influenza, you have fever, chills, muscle aches, headaches, significant lack of energy, and it's very similar to the symptoms for COVID. What they're suggesting is, and I'm working with our in-house nurse to put some protocols together, is that if you start displaying, and if the individuals start displaying any symptoms like that, fever, chills, anything like that, we initially address it as a possible COVID situation, meaning we make sure that they're quarantining and that they're wearing a mask and that they're not coming into contact. We're asking the staff to do the same thing. When you do go to the doctor, because we are treating it as like, let's say, a COVID situation, and you're going to be referred to please check in with your doctor, stuff like that. When you go to the doctor, they are asking that people get tested for the flu and for COVID-19. Now, this is very important because it changes the time that you are supposed to quarantine. When you have the flu, which there is a test, it's the same kind of system. They do a nasal swab and they can tell you a little bit more rapidly for the flu. They can tell you what strain of the flu you have, or they can tell you if you have coronavirus. If it's the flu, we don't call it quarantine because it's not designated a pandemic. The term quarantine is only designated for something that's a pandemic like COVID-19. For the flu, it is called activity limitations or restrictions. For that, they would only basically quarantine or be isolated for 10 days. That's what activity restrictions would be. But with that, there are subsections of it where if you're getting antiviral medication, it might decrease the amount of time that you have to have any activity restrictions or, be careful because you have the flu, as opposed to the 14-day process, if not longer, if you're actually diagnosed with COVID-19 and need to go through the process of testing negative. We've been seeing recently a lot of people testing positive for long periods of time, even after they go through their 14 days, just because of the incubation period of the coronavirus. So we're stressing, regardless if you get the flu shot or not, which we are recommending, and we hope that people really take that into consideration and try to get the flu shot, is if you're experiencing any symptoms, that when you do go to the doctor, you ask for both the flu test and the coronavirus test, because again, it changes the amount of time that you have to restrict your activity or be under quarantine.
Okay, great. I think this has been, I know I'm learning. I hope this has been helpful for you. We'll end in like a couple of minutes. I'll just do a quick wrap up. So if you have questions, now's the time. I'm also going to put Radina on the spot and ask Radina, would you mind recording a short Zoom in Spanish? Because I'm thinking we have a good amount of Spanish speaking staff that could benefit from hearing the main points. So maybe
Absolutely.
she'll say yes. Okay, great. Okay.
Yeah, absolutely. Or we can do something like this, because I know sometimes people have extra questions. So I can make myself available to do something like this if we have a group of people that really want to do a Zoom meeting and ask their questions, or, just make sure that they're a little bit clearer on the information. I'm okay with that.
Okay, great. Okay, so again, if you have questions, now's the time. Just to wrap up, all of the information we talked about is posted on our website, including the links. I also put the links in the chat as well, and the email, the HR email, is there. As Melanie mentioned, the flu program, she sent out a reminder earlier. So take into consideration or really think highly about getting tested. If you live or work in one of the clusters, make sure that we're highly encouraging you to get testing, and we will continue to do that on a weekly basis. It is showing to help because you might be asymptomatic. Even if you do not live in one of those clusters, consider getting testing. Continue to follow the precautions now more than ever, because we are more indoors with the cold weather. All of those precautions we went over also up on our website. and continue to follow the protocols that we have in place for reporting if you do test positive, as well as the new requirements, even if you test negative if you're in one of those zones. And as was mentioned in residential, there's some might be some different policies depending upon if one of the residences it falls in one of the clusters. But you know, most importantly, you know, thank you for continuing to be of service during this time. And we want to keep you safe. We want to keep the people we support safe, and we, you know, reviewed some of the ways that we hope to do that. So if there's, I don't see any other questions coming in. So I guess that wraps it up. Thank you so much. We have we had about 37 people that I saw in here, so that's great. Sorry for the short notice, and you know, wishing you guys all the best on the rest of your day. Take care.
Thank you, everyone.
Thank you.
Thank you for your time.
Thank you.
Good day,
Take care.
everybody.